Hello and welcome to another issue of Fikava VetChat. Hygiene in practice and the reduction of the use of antimicrobials is something that is challenging us every day in general practice. Tonight, I have the great pleasure to speak to one of, not only in her native Sweden, but a European authority on this subject. I like to introduce you to Professor Ulrika Grönlund from Sweden. She is the head of infection control at AniCura, and I would like to find out how she does it, and maybe she has some good tips for everybody who is watching this episode of Fikava VetChat. So good evening and welcome, Ulrika.
Oh, thank you so much.
Hi. Thank you very much for joining me for this VetChat. I think the last time we met was indeed in Sweden, and you were giving a really fantastic presentation on the way. You and AniCura had actually managed to reduce their use of antimicrobials in their clinics dramatically. And you were also sort of going with the whole team sort of through the clinic I was at the time then working at, and taking samples and talking to staff, looking at every little detail sort of where there could have been an issue with hygiene and so. And I mean, at the time, the clinic, I think, was doing very, very well. Yeah. They were all very, very committed. But I found, a completely different approach to hygiene to clinics I had seen in the UK, and also to some clinics in Germany. And what I noticed was the big sort of benefit of having this structured with a person who is sort of dedicated to this task and sort of skilled to implement it. But let's come first sort of to your personal journey into veterinary medicine. Was it always something you had planned to do?
Yeah.
Hmm? Yes. Why veterinary medicine? Why not human medicine?
Oh, no, I want to be with animals. Yeah, no. Yeah.
Okay.
So it was I was a dog lover from early age, or animals in general. And then I changed my mind really going to high school. I thought, no, I will become a CEO. That is my task. So I went to civil engineering course for 4 years at the university.
Yeah.
Up in Luleå, and got my first dog when I moved there. And unfortunately, that dog was pretty sick. And went a couple of times or several times to the vet, and I thought, gosh, this must be the profession to dream for, to examine, to diagnose, to prognose, and then follow up. I mean, medicine, what a fantastic subject. So I changed my mind. 4 years, civil engineering, way, and went to vet school.
Yeah.
So, yeah. So my loans are high.
Yeah. Okay, but that's interesting. So you were first in a different profession and then moved into veterinary medicine.
Absolutely. Yeah.
Which I think, a lot of the people that I met sort of that did something as well, I think very often they've given the profession just so much more because they have also a different mindset, possibly a more practical mindset, or they can suddenly cover areas which traditionally veterinary medicine was never used to. For example, I'm working together with a colleague who first did a degree in online marketing or something like that.
Okay. Yeah.
And sort of he is now very much into telemedicine. Because that is something he is very familiar with. Suddenly, these skills are very, very handy. Quite good. So then followed university in Uppsala, I would assume.
In Uppsala, yeah. And I have my sort of goal on becoming the best small animal practitioner. Okay. And then I got out and realized, I don't still I don't know anything. This is too difficult. So I thought research. I go for research. So I worked for a couple of years.
Well, how do you have a goal like that? Becoming the best veterinary surgeon.
Well, I think unfortunately, I have the habit of, I want to be good.
But yeah.
Yeah.
So you're very driven then.
Yeah, I think I'm driven. Yeah. But then I realized I wasn't that good. So I need to go for something. I need to specialize to get better. And I got my PhD, did it in infectious disease in cows, in dairy cows. So I did it on Staph aureus. So it was really fun. It was acute phase proteins and Staph aureus. So I learned lots of basic sort of infection prevention and control. And then I wanted to stay in Uppsala, and there came up a position at the National Veterinary Institute, SVA, in the department at that time of antibiotic.
And that was then also the time when you wrote your PhD. You did that together with the University of Ontario in Guelph.
No, that was so. I was started at the SVA at the National Veterinary Institute. Started there, and then I applied for this grant, a Marie Curie grant, together with Vinnova, and then I went to did my postdoc with Scott Weiss in Guelph, Ontario, Canada. Yeah.
And so, how did you like Canada then?
Oh, they are so sweet. The Canadians are so nice. They are wonderful people, the nicest people in the world, I would say.
Yeah. I don't know. I went over a couple of years ago to the World Congress in Toronto. I present Ficava, and we had a really great time, not only in Toronto, but we then also went to Alberta and went to the Rockies, and
cool.
Fascinating. Nevertheless, I have to say, I mean, I'm an outdoor person. I like the mountains, and I like to be in the woods. And I found it initially sort of quite interesting, this idea in being in an environment where they have bears and where they also have grizzly bears.
Yeah.
But then after a while, I thought, no, I can do without it. I mean, I never had any scary encounters.
No.
Always has my bear spray with me and stuff like that.
Okay, yeah.
Sort of then thinking about now sort of going hiking in the Alps, or especially if I'm out jogging, for example, or if I'm out skiing, for example, or roller skiing, for example. I mean, I met some colleagues over there, and the colleague, I spoke to her son and his girlfriend. They're very keen cross-country skiers. And she talked about one scenario that the girlfriend had, where she was coming with the roller skis down a hill, and there was a grizzly mum with two cubs on the bottom of the hill. So she had to pull the brakes and injured herself quite badly. And I thought,
nah,
no, don't need that. and especially, I mean, this fantastic biathlon site in Canmore. They have a lot of issues with grizzly bears up there. No, can do with it.
Yeah, I think I can do it too.
Yeah. So, but in Guelph, how long were you there?
I was there for 1.5 years. The scholarship was 3 years, so I continue back home in Sweden. I did actually in equine, so I was studying infection prevention and control in equine stud farms.
Yeah, exactly.
So that is my theme.
Really through the species. Yeah. So, and then you got headhunted by AniCura. They wanted to have you as then sort of your position is, I think, sort of chief medical controller, or
no, I'm just the group medical quality manager. Yeah.
Okay.
So I was I had actually a bit of a journey also at the agriculture university in Uppsala. So I was senior lecturing there for after I came back from Canada, and that's where I also got my associate professorship. And then I was headhunted, and that was really fun because I thought, I don't know anything about quality. I'm only very good at antibiotic resistance, epidemiology, and infection prevention and control. But quality, no. But I realized afterward that it was a smart move of the leadership team of AniCura at that point to have this broader aspect, because I mean, it's really about patient safety and it's about employee safety. So that was from where I then started to work with the quality and stayed with these two topics within my sort of backbone.
Possibly, I don't know, maybe also where the civil engineer came in again, because I mean, the theoretically you could probably have continued in academia endlessly, and that possibly would have been at the loss of really every, what shall I say, sort of practical input, where really you're, what shall I say, in a private business, your head is on the block. If you
Yeah.
if you give the wrong advice and things go pear-shaped, you are suddenly the person to answer. Whereas sort of, I think academia is maybe a little bit more cushy. But then as a civil engineer, if you say, well, this bridge is sound, and then you stand
It
or
needs to
fall
be, yeah.
with this comment. And if
Yeah, right.
things go wrong, they have a look, okay, who agreed or signed off the statics?
Exactly.
And so that's it's a brave move. Yeah.
Yeah.
But
And also
then,
I had with me the marketing, sort of marketing interest. I like marketing and sales, and that's why it made it also sort of interesting to make it sort of clear to everyone in the vet industry that AniCura was doing this quality work, and we were starting this program 2015 called QualiCura that I was sort of leading together with help from others, and that was, I mean, I have that in me to show to others what is our what are we different at AniCura.
yeah, I mean, that was something. I mean, I had the, as you will know through possibly through Alex Vilain, that Ficava is also sort of very keen to produce work on both hygiene and reduction of antimicrobials for our members, and we produced our set of infographics. Very much sort of, I know, I mean, that was a time when we very often sort of drew on your knowledge actually to back up sort of our work, or to find out, well, what is the general opinion on this or that. But then one of the documents that then came up was sort of the quality control report that AniCura came out with. And I haven't seen any other veterinary group or organization sort of producing such a detailed report, also showing what can be done, how much antimicrobial use can be reduced, and how it made fascinating reading. And I think, I mean, that is, AniCura is probably quite happy to, if anybody who's hearing this, so it's very happy to forward a copy to, or
absolutely,
to guide.
And you can find it on our website, anicuragroup.com. I mean, it's there. It's, you can find now. I'm just we're just finishing the last editing round of 2020 version, so hopefully it will be out now in April. So it's been really something we started in 2015. We hadn't much to write at that point because we just started, but then we have published everything we have been doing with this within this QualiCura program, and it's been about really focusing on 9 areas, where 3 have been my major contributions, and that would be wiser antimicrobial use, secure infection prevention and control, and monitoring surgical site infections. So, and together with that, I went then out to our clinics and discussing these 9 focus areas on site, and going through the clinic, looking at the hygiene routines, discussing how did they think about antibiotic use, did they ever discuss it, what are their routines, do we have any best practice in the clinics. So I did sort of a deep dive into each clinic, and before COVID I managed to maybe visit at least 250 clinics. So
yeah. I mean that I found sort of so interesting, because on one hand, I mean, you were known to me as an academical sort of personality, but there you were in the flesh, and then really going down to the nitty gritties in the clinic, and
yeah,
then also giving practical advice, what to do, what not to do, where to think maybe twice. And I mean, I have to out myself. When I started my own clinic, 1999, probably for the first 10 years or so, I gave routinely antibiotics after a standard spay of a
yeah,
cat or of a bitch. All orthopedic procedures got definitely antimicrobials. I didn't swap. I just, well, gave
yeah,
antibiotics to be on the safe side. So,
yeah, for a
and
week
I
or
think
two.
that's what I did there. And then I met Alex,
Mm-hmm.
and Alex was doing this fantastic work with our antimicrobial resistance group at
Yeah,
FECAVA. And so, and we talked about that, and she said, Wolfgang, no, it's not necessary. You don't need it. And then I thought, oh, come on, Alex is saying it, and I value her opinion a lot, and she's getting away with it, and they don't have any infections. And I mean, sure enough, I mean, if we were clean, we probably don't need
yeah,
it. So I started carefully, and sure enough, absolutely no need whatsoever, no post-operative infections. Again, providing obviously sort of hygiene
yeah.
was good.
Mm,
Speed of surgery was also a factor.
absolutely. Yep.
That's possibly certainly as
And
well.
speed of anesthesia is also included. It
Yep.
needs to be.
Yep. But then also sort of other areas where I thought, sorry, this is not going to work. I mean, that was, for example, very interesting in Sweden, where I admittedly sort of thought I want to see it in the flesh. When I had cats with cat bite abscesses,
Yeah,
I always gave antibiotics. And
yeah,
in Sweden was that you drain the thing, you give painkillers, you don't give antibiotics. If there is good drainage, absolutely no need. The lancing is important, but not antimicrobials. They don't do any, no difference. And then I thought, okay, I want to see that first before it works. And sure enough, also this worked, but obviously pain relief is important. And
absolutely. Yep.
and good drainage is important,
Yeah.
obviously. And again, sort of that changed a lot in my personal approach towards it.
Mm, mm.
But this was, I mean, these are all sort of things I learned from you guys. And yes, generally the Scandinavian countries, I mean, if we look at the use of antimicrobials in Europe, I think the Scandinavian countries are certainly
Yeah.
leading the way there.
Yeah, we are. I mean, in our survey, we have done our survey now for fifth year. For the fifth year, we did an antibiotic survey in AniCura, and that was something we decided early on to measure the use, to know where we were standing, and we can see a very much a marked drop in the region of Germany, Austria, and Switzerland, and also in Denmark, actually, who was among the higher. And there Sweden and Norway are on the lower side. So of course, I mean, we have had a different approach to antimicrobials in Sweden and Norway from the very beginning, starting off early 1990s with the farmers, and then we went on. So I've been in the whole journey actually from the days where every second dog got antibiotics in Sweden, because that was the time when I was working at the National Veterinary Institute. And the thing that changed our vet's mind was not really me or the other guys, vets, colleagues working at the National Veterinary Institute. It was really two things, and they can be abbreviated MRSA, MRSP, because they scared out of our colleagues, and they thought we need to do something. We cannot we cannot continue on this route, because then we will be not having anything left, because the MRSP we got was really multi-resistant, one of the worst sort of clones. And from that point in 2006, we started to work on this, and it was easy to get sort of hearing from the colleagues, because they needed help. And then I sort of went out from the institute, giving them practical advice on both sort of what to do hygiene and what to do with the antibiotics, because not every other dog was needing it. We were just doing it for the sake of, we were frightened.
Yeah. Well, and I mean, it makes perfectly sort of good business sense also. I mean, if you have MRSA in your clinic, this is, I mean, it can grind all work to a halt theoretically. So if this is really bad, and obviously then also look at the reputation of your clinic. So if there are a lot of post-operative infections and infections where you lose patients, although they just have come in for sort of, what shall I say, trivial procedure. Wow. And it's also, I mean, quite scary for the employees as well. I mean,
it's not nothing you want to have in your clinic at all. I mean, it's good thing is it's easy to get rid of if you have the right preventive measures, and it's not hard bugs to kill.
So how does your day-to-day sort of work? How does a typical week or so look for you? I mean, okay, at the moment with COVID, it's probably not so much on-site visit, but say before and hopefully after COVID, how does that look like?
Yeah, well, I would say that I'm sort of I have a support function. So that is my main task, to support our clinics in this work of these surgical site infections and antimicrobial use and infection prevention and control. And so besides that, I sort of conducted these quarterly surveys. I did at least 2 or 3 of them. And then we have maybe another topic. And then I went for these visits. So this has been my writing reports from the visit, writing reports from the results in the surveys, and then bringing forward guidelines. We have guidelines for infection prevention and control, for instrument handling, and now I'm also about to write the antibiotic guidelines. So I think it's been sort of, and also put role models put role models that are doing well, sort of say, hey guys, you can do like this, look, this works well. Like you were thinking of Alex, I mean, that was a role model to you, and those are the ones that are easy to follow. And so I would say that
can you sort of, over your sort of 5-6 years now with AniCura, do you have any figures a little bit to sort of quantify the improvements you have seen over the last sort of 5 or 6 years? Are there typical sort of, I don't know, examples of sort of average, say, cell counts that has gone down in sort of risk area, or reduction in the use of antimicrobials? Also, how much this has been reduced further?
Yeah, we have data for many of our clinics, and if you talk about the group average, we have gone down from like, I think it was like around 14%, 16% when we started off, and then we went down towards, now we are down below 8 in group average, and the goal is set to 5% on group average in 2030.
So that's 5% of consults will end up with
exactly. So only 5%, and that is a figure that has came forward in the work done in Sweden by Swedish hospitals, by colleagues.
And I mean, as you said, sort of when we're that sort of 20-25 years ago, 50% of each consultation use of antimicrobials. Yeah. I mean, we shouldn't be surprised that we have so much issues with antimicrobial resistance. There was just so much. And I mean, even before then, I mean, back at in the 1980s or so, I was working up in Norway, and they already had no longer a right to dispense. So nevertheless, it was so that there was still a lot of antimicrobials was used. So I remember one vet in the north of Norway, and he said, I met him, and he was not a very popular vet, and he said, well, I have a bottle of penicillin and a bottle of dexamethasone. What else do you need? So,
Oh, yeah, you get, oh.
well, but that, come on, that's a long time ago, and that was also not in a what was I say, very central area. So,
No,
but
but I got that comment really when I started the AniCura. I got that comment early on, and that was from the Bergen area somewhere there. That was not rural, but it was sort of, but if I can't give antibiotics, what should I do then as a vet? And then we are talking about 2015 and later. So I mean, it's
but
still
it is
something
still,
that is,
I mean, it's still something we encounter a lot in companion animal practice, that
yeah.
clients are not happy unless you are giving antibiotics. And it requires some, what shall I say, some backbone to stand up and to say, no, sorry, we don't need it. It's not necessary. It's in fact possibly making things worse.
Exactly. Yeah.
So, but that's not so easy, especially if you are a junior vet and there comes in the seasoned breeder who has seen it all, done it all, knows it all, and so then there you are, sort of fresh from vet school, and you have to say, well, no, I'm not giving you antibiotics.
Yeah, and that is tough, and that's why it's so important. I mean, we have guidelines and AniCura guidelines, but I only always emphasize the need to have the local ones, the in-clinic ones, because with the in-clinic ones you can feel safer, because these are the ones you have agreed on in the group, and then you feel much stronger towards this sort of maybe a bit very knowledgeable owner. I mean, that is you shouldn't sort of underestimate the need to have a group consensus on when to give antibiotics and not to give antibiotics.
If you would give sort of 2 or 3 top tips, if there's somebody listening now to this podcast or to this YouTube video, and sort of they say, okay, come on, how can I very easily and without risking my reputation cut back immediately, considerably, the amount of antimicrobials I use? What would be, I don't know, 2 or 3 top tips?
2 or 3 top
Can
tips.
you?
I would say you need to start measuring. So you need to find out where you use the most of your antibiotics, so you know where you should put your sort of focus on. And when you found that, you focus on these and see what you can do differently. I mean, there's lots of guidelines out there if you're not an AniCura member. And then I think it's also important to have a consistency through the whole sort of team in the clinic. So even if a question goes to the vet or to the receptionist or the nurse, you have the same sort of answer, that this can be dangerous, it's not needed. So you have sort of, once again, a group consensus in the clinic when to give and not to give.
And that has to go through every level. It's important. It's not just the vets. Really, the nurses, the receptionists need to understand the philosophy and the idea behind it. Yeah.
You need to have some communication skills. You have to be a bit knowledge about it to talk to the owners in a right way, to say that this is not needed, this is dangerous, and sort of the making a bit sort of scary for the owners and making them understand. So I think that will be my sort of, that is probably 2 or 3 tips in that one. And then if you start measuring, then you should hopefully get some back your data and saying that, okay, we changed or we didn't change. And if you haven't changed, you have to discuss that, of course.
I personally found also, I always thought it was really good, or the good business actually, to test. I took a lot of swabs from patients, so very often sort of started off, rather than giving antibiotics, say if there was I don't know, fresh cut or a contaminated
Mm.
wound or something like that, first thing to do is swap it. Swap it, swap it. You can always throw the swap away, but nevertheless, it is good practice to run an antibiogram.
Well,
Then,
I need to object a bit here, Wolfgang, because I think we have to make a step before that, before we take the swab. And that is, do I need to put these animal antibiotics? If you say no, then you shouldn't take the swab, because then otherwise you're a bit sort of, if you get the result, you're a bit tempted to do it anyway, or you need to do it because you did this swabbing and you need to put it. So have a bit of thoughts through first, but maybe you need it, like you say, you need it afterwards because you maybe are a bit uncertain about your diagnosis or what can cause it. And then you maybe need to have this in your hand, the result when it comes. But I think there are some sort of areas where you really should swab, and that's where you have these recurrent cases, because then you haven't got a clue about the resistant pattern that you encountered. But otherwise, I think sometimes we swab, for instance, a urinary tract sort of UTI in a bitch, and they have been on antibiotics, and you take this urine culture and you find E. coli, rich growth, pure E. coli. But I mean, the bitch is doing fine. Yeah. So we shouldn't be too sort of tempted to take a swab because we can. We have to, as always when we do diagnostics, we have to have a plan. Will this change my way of behaving, my change of plans, or depending on the result? Because it's easy when you get the sort of, oh, now it's E. coli, oh, it's pure growth. Yeah, we need to do something here.
Well, I mean, then you still, when you have the result, you can still decide, okay, is that now needed or not? Is the patient doing
absolutely, but it's a bit hard because the owner has paid for it. So you have a bit of, it could be that you feel a bit sort of I need to do something extra now, or
I often take swabs just as a backup, as a backup.
Yeah.
Have it there, and then I'm very happy phoning the owner then up afterwards, do a post-op check, and then say also the result came back from the lab. There's absolutely no growth, or the growth we've had is likely to be just from a contaminant, or if I have taken a swab, have put the patient on antimicrobials, then I also can say, well, the clinical progress is good, and on top of that, the bacteriology confirms we are using the right antibiotic.
Yeah, if you do it that way, I'm fine. But I know from the work I've been doing that sometimes can mix us up a bit when you take a swab.
Another subject, it's maybe a little bit of a hot topic. The Scandinavian countries, the vets in the Scandinavian countries don't have a right to dispense. So what you do is, if you want to prescribe a course of antibiotic tablets or also painkillers, for example, you have to write a prescription. The prescription is then issued to the owner, and they can collect it at a pharmacy.
Yeah.
I personally, that's sort of my take on that, think that probably is also helpful in the reduction of the use of antimicrobials, because the prescriber is not making a profit from the sale of the antimicrobials. That's my personal view. I think some people will not be happy with that view in continental Europe. On the other hand, I also have to say that as a word of criticism, this also I felt when I was working in Sweden meant that I wanted to prescribe something I would have made an effort for having in the pharmacy myself, in my own pharmacy. And I had that so often that basic painkillers, for example, were just not obtainable in the local pharmacies. And I thought, here, this system is falling flat. And is actually resulting in poor patient care or reduced patient care.
Because delayed. You have to wait for it,
That's the thing, but we had, I mean, this meloxicam, for example, was sometimes not obtainable at all at any of the local pharmacies. And I thought, if that would have been my clinic, I would have made far more of an effort. So I don't know, how do you look at that? Would you agree that this might also help to reduce
Yeah,
the prescribing of
yeah,
antimicrobials?
I think
There's
so.
no commercial incentive.
Exactly. I mean, I definitely think so. At the same time, I think it's always like this wherever you're practicing as a vet. I mean, we shouldn't be selling this. I mean, sell our 5.5 years of good universities knowledge and skills. So I mean, that is what we should sell, and we should become much better and taking credit for that, not that we can write a prescription. Because I usually say when I do webinars or presentations that writing prescription that you can do after 2 weeks is not difficult. I mean, that everyone can do. So I think we have to also, from university point of view, from the education, be sort of trained in how to sell our knowledge rather than doing this sort of writing prescription, because that is just a simple tool that we have.
Yep. I mean, again, I think that makes, on the long run, it makes good business sense. I witnessed that with my own clinic. I was admittedly sort of making good money through the sale of medication,
Yeah.
but then some years ago, on came the online pharmacies, and I had more and more and more clients coming to me asking for prescription because they could get the pharmaceuticals cheaper at the online pharmacy than I could have bought it from my wholesaler in the UK.
Okay,
So I
interesting.
found actually that sort of my profit margin or also the turnover figures, in fact, are generated by the sale of medication was actually dropping. And that where I really maintained and where I held the clinic and the overall turnover was diagnostics and yeah, skill operations,
Yeah, of course.
consultations,
Consultations, yeah.
advice, and I mean that is really the basic, the model, sort of what veterinary medicine ideally sort of should be based on. But obviously, maybe okay in the UK, I think colleagues in, I don't know, sort of Central Europe, Eastern Europe might say, well, but then you have, say, if you have double the number of competitors around the corner, life is much tougher. And it's easy for you to say, but well, it doesn't work here. We definitely need also an income through the medication.
Yeah.
Can
Yeah.
I jump again? Another
Yeah,
subject, and
absolutely.
can we come to a close? Obviously, while recording this, we are living in the times of COVID-19. Also, in your position, I'm pretty sure that a lot of the AniCura management, but also a lot of colleagues will have come to you and would have said, "Here, Ulrika, infection, that's your field. What are we going to do?" Sort of, how has this affected sort of the veterinary work in Sweden? How has that changed sort of your tasks, sort of, because you're probably also one of the central people, sort of the veterinary profession is looking at when it comes to COVID advice.
Yeah, I mean, it started off sort of with the scarcity of getting hand disinfection and gloves, and that was pretty the worst part. That was that was a tough one. I mean, talking from my point of view, I mean, I like to have a certain level that you use your hand disinfection, you use your gloves, blah blah blah, your apron, but that was now it's gone and we don't know. So we did a good effort in Sweden, joining our forces within the whole industry, and brought together and found solutions for different sort of setups, what to do if we didn't have this or that. So I think we had really good joint initiative in Sweden. From AniCura point of view, I think the main problem we have had is the people are sort of at home, sick leaves. We can't fill the positions because if you have a bit of cold or anything, you should be at home, and that is of course affecting us. But otherwise, from my point of view, I mean, I just love the use of that we now know how to use more alcohol on our hands, and I think this is a great sort of, once again, the bugs play in my favor if you just speak about this, like the MRSA and MRSP. You people know what you're talking about and then see the essence of good preventive measures in hygiene.
So you think because also of the training, which sort of at the moment might be COVID related, there might also be a good long-term effect of just improving hygiene,
could
possibly
be.
generally.
Yeah, we hope so. I mean, but usually you say that you have a 9 months that you remember, then you fade away, going back to old habits. And so, but I wouldn't like to have a new pandemic after 9 months.
Okay.
But that's the human brain. Yeah.
2017, you were given the Swedish Hygiene Prize of the National Association of Infection Control. How I would assume, I mean, this is sort of obviously a national prize. So how typical is it to be given to a veterinary surgeon?
No, actually it's like this. I shouldn't put myself too high. It's actually it's 3 prizes every year. One is always given to a vet or from the vet industry, or not always, but it's not. We should put it like this: 2 is always given to human medicine, I think, and then the other one is given to someone else from a different discipline. So I think there was a tattooer actually one year who got it. So, I mean, it depends. Yeah.
Okay. Cool. Okay.
They had very good sort of rigid hygiene routines. So I think it's. But anyway, I mean, it's not everyone gets it, and I was very happy for it.
Yeah. Certainly looks good on the CV. Yes, absolutely. Good. Ulrika, thank you so much for this vet chat. If anyone has any further questions about this vet chat or other vet chats, you can contact us on vetchat@ficava.org. I mentioned during this vet chat the Ficava hygiene in practice and use of antimicrobial posters that Ficava has produced. They can be downloaded for free from our website, which is ficava.org. Thank you very much for listening or watching this vet chat, and I'm looking forward to seeing you next week for another episode of Ficava Vet Chat. Take care and stay safe.
Thank you.